All right, Anush, we are live.
Hey guys, I'm Anush and we are live at Dr. Emer's office in West Hollywood. It's filler night and we all are very exciting. It's really late, but we're still here doing our fillers for filler night. I have my beautiful client here. She's getting facial sculpting done today, so we're gonna go over some details of female facial sculpting. So what we're gonna do for her today, we're gonna lift her cheek, provide a little bit contour, a little bit more lifted look. We're gonna do a little bit filler in her temples just to provide this nice and lifted look to her eyebrows, prevent it from sagging. Definitely at some point we'll also add Botox to do the full look. We're gonna do lips today, which I'm very excited to. We're gonna add a little bit in her jawline to just provide more snatched look, probably a little bit in her chin. Okay, so we're gonna start with her cheeks. So cheeks is one of my favorite areas to start because that's an area that will provide the most difference without even looking done. And obviously our main goal today is for my beautiful client to look more youthful, to have more definition. However, it's also very important that she looks natural, so that's her main goal. So whatever we're gonna do, it's very important for us to keep her natural look, and she's beautiful. She has a nice, beautiful shape, and that's what we want to preserve and improve. So we don't want to.
All right, someone's asking if this is Botox. Guys, this is not Botox. This is our hyaluronic acid fillers.
So this is a hyaluronic acid filler. Right now I'm using Voluma, and that's one of my favorite fillers for the cheeks. The reason I like Voluma for the cheeks because Voluma is a little thicker than other fillers. It lasts longer, and it provides nice contour, good projection. And the reason I also like Voluma because it mimics bone structure, so we can recreate kind of a bone structure and provide that definition in the cheeks and in the jawline and the chin. Of course, we have different options for fillers. Voluma is a hyaluronic acid filler, so hyaluronic acid fillers, they're very natural to your body because we all have hyaluronic acid in our body. So usually any type of allergic reactions are not a concern with hyaluronic acid fillers. And you can see how her right side of her face already looks more contoured, more lifted. That's what we're looking for. I'm gonna move to her left side. So this isn't her first time. This isn't her first time getting fillers done, definitely. And this is more of a maintenance treatment for us. So we do it once in a while for her. And that's why she looks so youthful and so lifted. And literally just, maintenance treatments are enough for her to look great. Of course, combined with skincare, combined with laser treatment, with microneedling PRP. She loves microneedling and PRP. Okay.
All right, we have some questions pouring in for you guys. Can fillers be used as preventative care?
Yes, for sure. So fillers can be used as preventative care. We can use fillers to volumize face. We can also use fillers to prevent skin from sagging, skin from looking, to prevent basically aging. So the best way for preventative care is to use laser treatment. We also use fillers for preventative care or just maintenance.
All right, someone said, if someone already has naturally high cheekbones, what would you recommend to make the face look more thinned out and lifted?
So we would like to do a consultation for that because we have different options. We can definitely do a consultation and see what would be the right option for you. We can do threading, we can do fillers in a technique, in a way that it will make your face look slimmer, and that's what we're doing for her too. She's gonna look slimmer because we're lifting her cheeks and making it laterally lifted. We're not necessarily adding volume to her mid-cheek area. We're doing a lateral lift that's gonna make her look slimmer and more contoured.
Okay, so can you guys remove old scars? Guys, we do tons of work with new scars. We can do stuff through older scars too. If you guys want to get something to know your scars, send us a DM, full name, email, and phone number. Let's get you a consult. Let's look at your scars, and we'll get them gone. Why do you choose Voluma over Radiesse?
So why do we choose Voluma over Radiesse? So that's her preference. Radiesse is great for cheeks, definitely. So Radiesse is great for definition, for areas such as cheeks, such as chin and jawline. But for her, we're just using Voluma because Voluma is a HA filler and she's more comfortable with an HA filler. So HA filler is something that is a little bit more comfortable choice for a lot of our patients because you can reverse it if you need it, and also over time it starts to disappear, so patients like to kind of come back and get it done again. They don't want to commit to it for long term necessarily.
All right, Anush. Somebody needs a lift on the eyebrows and a little bit of tightening around the jaws, like I have no wrinkle. Do I get nice and tight?
We can do that. So that's obviously most of the time will be our neurotoxins such as Botox and other ones, and depending on the amount that we use, it's gonna either give just smoothing effect or it can also give no movement effect pretty much.
Okay, that's right. We do have several neurotoxins here. We have our Botox, we have Dysport, we have Xeomin, and we have other stuff for the forehead too. We can do stuff to give your brows lifted. We can do PDO threads. We have our Insta-Lift threads as well. We can do throughout the face for a mega lift.
Jordan can be a treatment coordinator now.
I can.
He knows all the treatment plans.
Yeah, so Jordan is really great actually, and you can DM us or email us
Guys,
with your full name.
email and phone number. We'll have our team reach out to you.
We'll reach out to you and definitely find the right treatment. So the great thing about our clinic here, we have every kind of option, pretty much anything that you can think of. Okay, so we did a little bit in her cheeks, we did a little bit in her temples. Just give a little more balanced look by providing a little bit elongation and projection to her chin. And that's just, again, just the touch-up treatments because she's been doing that for some time and we're just doing pretty much maintenance. We're gonna go to her lips and give her a little bit of a pop using Volbella. So Volbella is a great option for our patient who want more natural look, hydrated look, but don't want necessarily large volume, don't want a change in the size of the lips. Okay.
All right. You guys, so let's see. What if I'm losing weight? Guys, if you're losing weight, you most likely will lose volume to your face as well. We do it for a lot of people. We'll add fillers to your face. We'll balance it out and fix the volume loss for you. What type of filler is that, guys? This is our hyaluronic acid filler. What are we using for the lips, Anush?
So for the lips, we're using Volbella. Again, Volbella is a hyaluronic acid filler. It's a great choice and one of my favorite choices for my clients who don't look to get necessarily bigger lips, but who want more hydrated look, more natural look, softer pop, and some amount of volumization. So she's done that before. We're gonna do a little touch-up treatment for her right now. So we're gonna definitely give her better definition.
Is the injector a nurse practitioner, guys? This is our nurse practitioner. This is Anush.
Yes.
She is here at Dr. Emer's office. You guys can get a treatment with her anytime you want. If you guys want to come see Anush, send us a DM with your full name, email, and phone number. She does amazing work. She does fillers, lasers, and much more for you guys.
Definitely, I'm ready to see you, do your consultation, and get you the right treatment. So we're gonna provide her more lifting in her upper lip and more defined cupid's bow, more of a heart-shaped look to her lips, which she likes, and it's gonna look definitely really balanced with her.
Was the patient numb for lip fillers, or did we do nerve blocks? No, guys, we don't do nerve blocks for fillers. It's not that painful. We just do topical numbing for a little bit. We'll wipe you off, and then we'll start treatment.
So yeah, definitely. She doesn't need a nerve block. Our numbing cream is pretty strong. It does a pretty good job with numbing, so you can see she's pretty comfortable. Are you comfortable? Yes. Well, you know what? Sometimes we see our patients running tears, and that's not necessarily tears of pain. That's a reflex from injecting lips or tears of joy. So we're gonna give her a little bit more potty look in her bottom lip.
Someone's asking what gauge needle, guys. We don't tell you that kind of stuff. Our secrets.
Yeah, so we will definitely.
Settings and sizes are things we don't disclose.
Yeah, we'll decide on what filler to use, what gauge needle to use individually depending on the treatment and goals of the treatment. So for the lip fillers, one thing to remember, lips are very vascular, so bleeding is pretty much
It's very
common,
normal.
and it's very normal. Bruising is one of the side effects that is very normal and expected. Usually bruising doesn't last more than a couple of days.
So see, why do we not use a dental block, guys? It's not that painful. We do lip fillers all day. News does them all day. We just topically numb our patients, and they do just fine.
So if patient preference is to do a dental block, we can do it, but most of the time patients are very comfortable and they don't need an extra needle poke.
All right. How long is Volbella gonna last?
Volbella is gonna last anywhere from 6 months to a year. Honestly, it's very, very individual. For the lip fillers in general, first time when you get a lip filler done, it doesn't last that long. So you need to do a couple of treatments. Usually I suggest my patients to come back every 2 to 3 months for the first 2 or 3 treatments. After that, kind of lips get into that shape and don't need that much of a maintenance, maybe every 6 months to a year. But the first couple of times you want to come back every 2 to 3 months. Especially if you want to see a change in the size of the lips. And for her, that's not an issue, but a lot of times we want to increase the size of the lips, and that takes a little bit of a time because we don't want to inject too much in one session. So we definitely want to do more of a gradual work with that. So lip fillers might look as like something simple, however, it's important for you to go to an experienced injector because lip fillers are actually very complex. Lips are what you probably see first looking at a person, and it's important to get that symmetry, harmonized look, not too big, not too small, to look at the profile and make sure that the projection of the lips is not too far away from the projection of the chin and the nose, so it's an overall balanced look. And we're gonna turn up a little bit the corners of her lips too, to prevent those marionette lines from forming. And that's one of the ways when we use it preventatively, providing support. So she doesn't really have marionette lines right now, but we're gonna use the filler to provide a little bit support. Almost done with the lips. I'm sure my client is just gonna love her results.
We'll show you her results again. We'll show you her before and afters. We'll show you her immediates. If you guys follow, we'll also show you her a couple weeks out so you guys can see what she looks like when she's all healed. There's no swelling and no bruising. So let's see what amount of filler, guys. Not gonna tell you that.
We're not gonna tell you that.
You might be an injector yourself.
I can promise you that we're gonna inject you just as much as you need. So we don't inject to use just, the whole syringe or in those type of things. We just inject as much as you need to make sure that you have harmonized look, proportional look. So, and that's something that we can discuss with you during a consultation. We usually will have a more of a long-term plan of care with you, which will involve your overall skincare, the laser treatments that we can offer you, skincare routine at home, fillers, and neurotoxins. So for our beautiful client, we're still gonna do a little bit more. We're gonna add a little bit Botox in a couple of minutes, but we did her cheeks, we added a little bit volume to her temples, and that's a great way to keep her eyebrows lifted, to give contour and definition to her mid-face, and overall provide more slimming, more more youthful look to her face. We did a little bit in her chin, which elongates her chin and provides that more of a heart-shaped look, which is beautiful and very feminine. We did a little bit filler in her lips, and we did more of a thinner filler, which will provide her with very natural results, but a beautiful pop. And we'll show you the results later. Thanks for watching.
Thank you, Anish. See you guys later.
See you later, guys.
Perfect.